But if we want to stay as Melanie, that's okay.
All right, well, we'll kick things off. Good afternoon and welcome to today's legislative listening session. Since this is a Zoom meeting, we ask that you keep yourselves muted until it's your turn on the agenda to speak. We do encourage questions, and you can type your questions by clicking the chat box in the lower part of your meeting window. This meeting is also being recorded, and a link will be provided to you within about 2 business days. Thank you again for joining us today, and now I'd like to welcome Melanie.
Thank you, Mitch. Really appreciate it. So welcome, everyone. Thank you for joining us. We do really appreciate it. For those of you who don't know me, I'm Melanie McAleenan. I am the Director of Government Relations and General Counsel for the Association of Counties. And again, I just want to say thank you for taking time out of what I assume is a really busy schedule to join us. I know that this specific time was difficult for some of you, and so thank you for accommodating us. Trying to fit in 8 webinars over the course of 2 weeks was pretty difficult, and it didn't allow a lot of room for leeway. So again, thank you for those of you who had to make accommodations in your schedule. Like I said, this is our 8th webinar. It is our last one. We grouped counties by region as best we could. So for some legislators, that means that potentially to hear from all of the counties within your jurisdiction, you would have to listen to more than one webinar. If we had more ahead of us, I would say you were more than welcome to join any of them. However, since this is our last one, I will say instead that we recorded all of them, we took notes for all of them, and we have the PowerPoint for all of them, and that is all shareable information and is being emailed to the people in those, to the legislators in those districts, but also will be available from us if it's something that you didn't get and you want. We are planning to spend about 20 minutes today at the beginning talking about our current situation in regard to the pandemic. We will hear from Dr. Bob Lutz of the Spokane Health Department. And then we will move on to about 25 minutes, 5 minutes per county, to talk about the impact of the pandemic and the county's response to the pandemic has had on county functions. And when we get there, you'll see a slide with some ideas, but obviously it's very different county to county. And so those are just there to trigger your thoughts, and you are clearly more than welcome to speak to whatever needs have come up as a result of having to deal with this. And there's been some really interesting examples that we've heard and even, experienced on some of these webinars. For example, in the northwest corner of the state, it was very clear that broadband was a real problem, and working from home and trying to do school and telehealth and whatnot is a real problem when you don't have a really robust network. So we've gotten to experience some of it for ourselves, and also really like to hear about it from all of you. Then we will do another 25 minutes where we ask that you turn your focus toward the future and thinking about our new normal and what that is or may become, because obviously it's something that's very much in flux. What are the things that you're thinking about in terms of getting back to a healthy and prosperous county for your businesses, for your constituents, for yourselves, and what do you need to make that happen? And what's really keeping you awake at night as you're thinking about what are the next steps that need done going on into the future? And after that, if we timed this all correctly, we will have about 20 minutes for questions. And right now, actually, you are more than welcome to use the chat box. If you take your mouse and run it along the bottom of your screen, there is a box, a message box that says chat. You can type messages into that. We will see that they're there and answer them immediately if it makes sense to where we are in the program, or hold them until the end, depending on what it is. But if you're worried about forgetting what you wanted to ask, don't hesitate to type it in there and we will get to it. So with that, I want to turn over to Jamie Bodden. She is our Managing Director of the Association of Local Public Health Officials. She has been busier than you can possibly imagine. And I think that's just going to be how it is for a while, but she has been gracious enough to take the time with us today, and unfortunately does have to get off to go to another meeting here pretty soon, but can introduce us to Dr. Lutz and get everything kicked off.
Great, Melanie, thank you so much, and welcome to our final session. These were fast and furious, and so thank you for participating. Local public health has really been at the front lines of this response, and has been at the front lines of this response since January. For the legislators and the LAs that are on the line with me, you probably remember that I sat with Dr. Weisman, our Secretary of Health, on a couple of panels, and we're updating you during legislative session on COVID-19. So it feels like forever ago that happened, but really that was the last, the 100 days is when we had our first case to now. And so a lot of things have changed in those 100 days, but our local public health has been working those 100 days very, very long hours, but very, very hard to protect our communities. It's my pleasure to introduce Dr. Bob Lutz. He's the health officer for the Spokane Regional Health District. He's also the health officer for the Spokane County Health District. They had participated in a previous session down with their region. So he's got some good perspective about urban-rural needs for COVID response. In addition, Dr. Lutz also sits on our State Board of Health as the health officer representative. So he's got some really great perspective and insight, and appreciate all of the hard work that he is doing in Spokane and across the state to protect our communities. So with no further ado, Dr. Lutz, I turn it over to you.
Thanks, Jamie. Can you hear me okay?
Yep, you sound great.
Great, thank you. And I do have to note that my name does not have a Z at the end of Bob. I am a palindrome, and I do not have, it's not Bob Z Lutz, but anyway, just an aside, Jamie. So Jamie asked me to do this a couple of days ago, and so I apologize. I don't have a real script or anything, but I am sort of working off of these slides that I believe have probably been used in previous presentations. And as you can see by these four sort of graphics, certainly with respect to COVID-19, at that time it was called novel coronavirus. It has since had its name changed. We were aware of it. We were very much monitoring it, but we did not know a whole lot about it. In Spokane, we have certainly been benefited by having a very large health district. We have a very strong communicable disease program that serves all of actually 6 different counties in Eastern Washington and supports those counties. We also have a very strong emergency preparedness program that as of 2.5, 3 years ago was identified as being the Eastern Washington resource for emergency preparedness. So we had that as basic infrastructure. We also had learned from the pandemic of H1N1 back in 2009. We had medical surge planning that had been done through a healthcare coalition of Eastern Washington, and brought in an outside advisory group called Russell Phillips, which had provided a survey in 2015 that gave us a snapshot of our infrastructure. We had alternate care facility plans in place, fatality management plans in place, isolation and quarantine plan in place. And we also had the basic infrastructure for an incident command system, which we mobilized very early on in this pandemic. It had been stood up in the past, in the most recent past, for wildfire season, and in our mumps outbreak of a couple of years ago. So our incident command structure was actually fully established February 26th, but irrespective, we had been meeting on a daily basis for almost a month prior to that. So we had good infrastructure going in. As Jamie mentioned, I'm also the health officer in Spokane County, and I live in Spokane. And so my interactions and connections with Spokane are not nearly as strong but the compare and contrast is stark. Whereas we have a health department here in Spokane of approximately 265 staff, we have a health district in Asotin with a staff of 5. And whereas I have a communicable disease epidemiology team here in Spokane, I have an administrator who's been doing the disease investigations down there with some support from here. So again, the compare and contrast is stark. And when you realize that this outbreak, this pandemic has affected every county, albeit some counties differently, there's a lot of disproportionality based upon availability of resources. So one of the things we started doing early on based upon CDC guidance was monitoring individuals who were coming to Spokane from areas where we knew the outbreak to exist, such as specifically the Wuhan and then the Hubei province. We were not seeing a whole lot of individuals. That said, we did have our first actual, what we call PUI, person under investigation, in February. And for us, the learnings were many, because it was a investigation that required us to collaborate very closely with the Department of Health and with the CDC, because at that time, testing was only being done by the CDC. And of course, as always happens, this happened on a Friday night into Saturday, which required us to be working on the weekends, which in and of itself is not unusual. But what was problematic was being able to get the specimen here in Spokane back to the CDC. And you would think that that would be somewhat simple, but the courier system functions differently on the weekends. And so it was a conference call between myself, the state epidemiologist, my epidemiologist here, the hospital where the test was being done, and a CDC physician who concurred that the testing should be done. And it was done. We had the specimen drawn and taken care of on Saturday morning. It didn't get back to the CDC until Tuesday morning. We didn't get results back until Wednesday, during which time the family was in quarantine and the individual was in isolation. So it was not a system that was necessarily made for convenience. And it also was very challenging from just trying to pull all the pieces together. Thankfully, it has gotten better, but I think we can all reflect on the fact that as a system, as a national system, we were not well prepared to deal with the pandemic, and we have unfortunately paid the consequences, starting off with PPE as a major issue, and just looking at simple things like swabs, like Q-tips, and viral transport medium that hasn't existed. And so that's been, again, one of the many challenges for us moving forward. We definitely, if you look at the graphic coordinating with public health systems, as I mentioned, it is a coordinated effort. It was from the get-go, albeit a lot of lessons learned. So we've been collaborating from the onset with Department of Health, or other local health jurisdictions, and of course the CDC. We've been very proactive at providing guidance and prevention to schools, to businesses, colleges and universities, childcare providers, and of course, local electeds like yourselves. We have been following statewide guidance and also applying a local context. As you all know, we've been talking about how Eastern Washington is different. I used the saying early on that we're oftentimes compared to Western Washington. In this situation, we don't want to be Western Washington, because how they got hit was they got hit very, very hard, very quickly. We were able to learn from those lessons. I remember very, very vividly talking with my colleague over in King County on Thursday morning before we issued our first health officer order locally. And I asked him if he were to do anything differently, would he? And he said, yes, I would be much more aggressive, much quicker. And I think, again, we benefited from that lesson because, to our credit, we did initiate many of the mitigating interventions from the get-go, very early on, and I think that has helped our numbers. What else? Of course, we know that Governor Inslee declared a public health emergency on the 29th of February. Here in Spokane, I did likewise very soon after, primarily because it just provided more readily available access to resources and funding by doing so. Locally, there was an event that was coming in. There was a Class B basketball tournament that was, what I understand, bringing maybe 10 or 15,000 kids ages 4th grade through 8th grade, as well as their parents and friends to Spokane. And that was of great concern for obvious reasons. And I had to cancel that event. And over that first week, we had our first patients identified on the 14th of March. Irrespective of that, we knew that COVID-19 was in our community. We just didn't have documentation of having it. And as a result, there was a lot of dialogue, a lot of perceptions, a lot of questions as to why are you doing this? We see it on the west side, but we don't see it here. Why are you doing it here? That conversation was had likewise down in Asotin, where the very first case in Asotin County occurred on the 3rd of April, a full 2+ weeks afterwards. So the fact that we saw COVID-19 cases here in Eastern Washington at a later date, it didn't necessarily mean that COVID-19 wasn't here. We just didn't have confirmation of it at the time. And as we saw in the west side, its community spread was significant. Where early on we were looking at mostly travelers and people who had come in contact, we quickly realized that COVID-19 was spreading throughout our community. So as I mentioned, our cases here began in March, mid-March, but we quickly saw a ramping up of the number of cases as was to be expected. You may have heard a term called R0. It is a measure of just how contagious this infection is. For example, the R0 of measles is somewhere between 13 to 18, which means that for every one individual who has measles, he or she will infect another 13 or 18 individuals. The R0 for seasonal flu is less than 1%. In COVID-19, the R0 is about 2.6, 2.7. So for every 10 individuals who have it, they will infect and cause another up to 27 infections. So you can see that this is an infection that rapidly multiplies. And given what we understood about it at the time, that it's being spread by respiratory droplets that are, again, particles that are exhaled during coughing or sneezing, the concerns for it quickly spreading for the community were great. At the local level, this has been, as I have mentioned previously, and as I will mention going forward, has truly been a community-wide collaboration. We've had support of elected government, service providers, the healthcare organizations, obviously the business community, nonprofits, philanthropy. We were benefited by having an emergency team, an incident management team already in the Spokane area, which really helped to mobilize us. Whereas we had different organizations, we had cities, county, public health. Having an incident management team with that skill set to bring everybody together was really key in us being where we are now, and as we quickly progressed into a much better position going forward. Within the health district, we've reassigned essentially almost 50% of our staff. And as you know, most of the staff are funded through various grants and other programs, which they've not been able to do because they've been reassigned, which is again a real challenge for us. That said, we've maintained many of the basic requirements of public health, obviously the communicable disease investigations, as well as all of the sanitation issues, restaurant inspections, albeit they've obviously been pared back because restaurants aren't open, but we're still doing all of those requirements that we are obligated to do so for public health. Working with client services, we have an opioid treatment program, we have a nurse-family partnership, we have a TB program, an HIV program. all of those have had to make modifications on how our staff are working with those individuals. And this is a public health emergency. And as such, it has clearly put public health at the forefront, which for me is not necessarily where I want to be, because public health, as you know, oftentimes happens behind the scenes. We joke about the fact that we don't make ourselves known. And you see, from a safety standpoint, police and sheriffs wearing uniforms and firemen wear uniforms. Public health, we wear vests. And people don't know what we're doing, but this has brought us first and foremost to public awareness of the role that we do 24/7 to keep our community safe. Within our efforts, we've really been looking at not only COVID-19, but also all of those other components of public health that people are experiencing. That again, we're looking at lives and livelihoods, how social networks have been impacted, business continuity, food insecurity, homelessness, childcare, and great concern about mental health, behavioral health, domestic violence, intimate partner violence. All of those elements are part of this very comprehensive approach, albeit focusing at first on the virus itself, but acknowledging that all of these are indirect repercussions of that focus. Case investigation. It is labor intensive, and as part of the next phase, it will definitely become even more labor intensive. Early on, we were quickly overwhelmed in being able to do those contact investigations, which may take anywhere from minutes to a couple of hours, just depending on the complexity. Department of Health has been very much involved with that. And going forward, you've heard of the intention of having a workforce of anywhere between 1,000 to 2,500 individuals who are going to be doing those contact investigations, understanding really the disease burden in our community. Currently, we have 360 plus infections. Our numbers have been slowly, they've been maintaining. We've certainly flattened the curve. It's important to realize that what I report, when we talk about our numbers, just absolute crude numbers. If, however, I look at rates, such as case rates, such as infection rates, such as mortality rates, hospitalization rates, Spokane County has a poverty level of about 13%. And not surprisingly, since COVID-19 does disproportionately hit people of poverty, racial and ethnic groups disproportionately, our rates are higher than what I would like to see. Going to my pages. So isolation and quarantine, early on, we identified at-risk populations. Not surprisingly, any metro area has certain populations of concern. For us, it were people living homeless. And as a result, we were able to focus on an isolation site more broadly for the entire community, but certainly that population of homeless individuals was of great concern for us moving forward. We identified an alternate care campus at the fairgrounds, repurposed some buildings. We had staff look at how we would be able to actually build a hospital out there, so to speak, an alternate care facility that would serve as a step-down facility for hospitals if they were overwhelmed. Thankfully, we've not had to see that happen. Likewise, that's not happened across the state. Let's see, community measures. A lot of it has been, again, education, working with businesses, working with those essential services. How do they continue to work in a healthy fashion? We have locally closed some playground features, but kept parks open. And then obviously this past week, with the relaxing of some of those closures, we know the public lands are available to some degree. We had a press conference today talking about the opening of golf courses and of course fishing. With respect to that messaging, it has, I think early on, been very well received. As time has elapsed, I think it is proving to be a little bit more difficult because people are getting restless. if you don't see huge numbers, if you don't necessarily know somebody who's been impacted, it isn't quite as meaningful. And so I think going forward, that messaging is going to be a challenge. And again, depending upon what Governor Inslee decides and announces tomorrow, we may be seeing that messaging for a while to come and really trying to focus on getting people to stay home and stay healthy. And just obviously the slide has been moved forward to me, so I will go on to challenges and looking ahead. It's going to be, again, a challenge, I think, at many, many levels. We've talked about lives and livelihoods. Public health has certainly jumped in to address lives. As elected officials who are very concerned about the livelihoods of all of your constituents, as am I think we need to look at what the next steps look like. Am I concerned about a second wave? I don't know what that would look like, but yes, the concern exists. And that's why I think, the metaphor I've used is that you're opening the door, albeit very, very slowly. It's like opening the door to someone at night when you don't have a light at the front door and you're not quite sure who's out there. I want to be able to slam that door really shut if I need to. So I think we need to be opening the door very, very slowly. I think one take-home message, however, that I think everyone has come to realize is that public health is really important. We work behind the scenes, but going forward, I truly believe that this represents a wonderful opportunity for greater collaboration between public health, the business sector, all those different areas that we touch oftentimes indirectly and unknowingly. I think people will know that public health is truly out there to keep them healthy. Very fortunate that we have foundational public health services and funding to, for example, do communicable disease investigation and being able to share that expertise with other local jurisdictions has, I think, really been a benefit both locally and regionally. And with that, I'll stop.
Great. Dr. Lutz, thank you so much. I really, really appreciate it, especially as you were voluntold just a couple of days ago from from your team. So very much appreciated for you to pitch hit, and your examples were really great. I think you provide some fantastic nuance and things that you were looking at for Eastern Washington and your region. Absolutely. And just thank you for all the work that you're doing and your response teams are doing both in Spokane and Asotin, but just even across the state too. A reminder for folks, if you do have a question, please type it into the chat box. Dr. Lutz, thanks again. And Melanie, I will turn it over to you.
Thanks, Jamie. And Dr. Lutz, thank you again from all of us. We know how hard that you are working and that your team is working. So thank you so much for taking the time. So now we will turn it over to about 25 minutes, 5 minutes per county, to talk about how responding to the COVID-19 pandemic has affected county functions. And so this can be everything from just the basics of what things have you had to change rapidly in order to accommodate the stay-at-home order, for example. I mean, we had one county that had to go buy a bunch of computers from Costco because they didn't have laptops and they didn't have any way to get them quickly otherwise. We've had counties that have real problems with broadband, like I told you earlier. We know that there have been impacts on jails, for example. We absolutely know that everyone is worried about budget and finances and the economy. And I think so that's kind of something that fits in both parts of both of the questions that we're talking about in terms of the expenses that you've had to put out for the pandemic, as well as the impacts it's going to have on your budget and the services that you provide to your constituents going forward. So the second half of that we can talk about in the second question. But like I said before, these are just some examples. I have no doubt that you have plenty of others. So why don't we get started, and we'll just keep with the Spokane theme. And we had several people join kind of at the last minute, so I'm not sure who all is on, but I know that Commissioner French is on because I saw his face earlier. So Commissioner French, would you like to give us the scoop on Spokane County?
Sure, thank you, and thank you for putting this together. Spokane is a consumer-driven economy, and we rely, in fact, about half of our general fund is sales tax revenue. And so when there's an impact on sales tax generation, that has a significant impact, not only to a general fund, but we also provide a number of services that rely on sales tax, like mental health, like criminal justice and stuff. So we're anticipating, I'm sure we won't know until next month, but would not be surprised to see about a 20 or 25% drop in retail sales tax. The fact that the governor has opened up home construction and hopefully general construction, this helps because they're big retail sales tax drivers for us, but car sales, boat sales, RVs, all of those things are going to help get our economy back on track and get revenues back into the county budget. It's not a surprise we're a size to get back into production. We need to resource PPEs, testing kits, equipment, and tracking systems and stuff. So that's a focus that we're engaged in right now. And then food continuity is also a big issue. Our food bank, Second Harvest, has just been overwhelmed with the demand for food, and with restaurants not being in operation or not at the level that they typically are, those food products are not as abundant as they used to be. We're also in the process of standing up a 100-bed homeless shelter for separation and also isolation. So we're working with a couple local hotels to see if we can contract with the acquisition of some beds. The judges have helped with regard to reducing the population in our jails. That's the good news. The bad news is they let more criminals out on the street. So we are seeing an uptick in criminal activity. And in fact, just yesterday, the sheriff launched a new task force to deal with property and burglary crimes here in the community. So we have about 2,000 employees, and about 600 of them are working remotely. So we did have to upgrade our servers and routers to be able to handle that many employees working remotely, as well as laptops and stuff. But that seems to be working out fairly well now. In terms of impacts on industries, the tourism industry has taken a hard hit. That is a good driver for us in terms of retail sales because it helps our hotels, our restaurants, our retail operations, plus the convention facilities, which are a public facilities district, and the county is a fiduciary for the PFD. Our hospitality industry is sitting at around 90% unemployment. Hotels have been shut down. Those that are open are bouncing around 10% occupancy rate. So that's an industry that we're really focused on trying to get standing up. But as a community, we're looking at about 45,000 unemployed in a community. So we are regionally trying to address how do we get our economy standing back up? How do we get people back to work? How do we get them a paycheck and not an unemployment check? And financial stability and stuff. So we are working on a couple regional efforts along with our business community to figure out how do we stand back up and do it safely, but at the same time get people back to work. And we've got about 130 companies that are part of the Boeing supply chain. And with Boeing cutting back, a lot of our companies are going to have to be retooling or cutting back dramatically on what they do in the aerospace sector. And then finally, with the home builders being able to get back into production, it's going to help us with we were already suffering from a housing shortage, and the suspension of housing construction would have put a lot of healthy homeless people into our, so we're very excited about the fact that they're back to work stuff. So that's kind of a real quick summary of where we're at.
Thanks, Commissioner. Appreciate it. Have you used one quick question for you? Are you seeing or are you concerned about backlogs in the courts when they're able to come back online, the things that have been put off? Have they been able to keep up okay, or is that going to cause a problem, do you anticipate?
What I think it's going to do, quite frankly, is it's going to accelerate early case resolution and some other improvements in the criminal justice system that, quite frankly, were dragging. The old saying, don't waste a good crisis. I think this is going to force a lot of reforms in the criminal justice system that we've been working to try and implement for a while. And, we had a jail that was designed for 462. It was populated around 900. And so we're down now under the 500 threshold. But it is going to force the courts to institute some programs to try and process that backlog, as well as our public defenders and prosecutors.
Thanks, Commissioner. How about we next move to Lincoln County? I'm pretty sure I saw some Lincoln County individuals on the line.
Hi, Melanie. Scott here. Hey, thanks. Yeah, like Commissioner French said, thanks for putting this together. We really appreciate it. I have Commissioner Kaufman, Commissioner Stedman are both on here too, so I'll hit off a couple things and see if there's anything that they have too. So Lincoln County, we're Spokane County's neighbor to the west, where Commissioner French has got 500,000 people, and we have 11,000 in Lincoln County. So a lot of different things are little on the side of the effects of this. We have not had the positive cases that have been in Lincoln County have come from outside of the county. So we're fortunate enough that we've been able to hold that at bay. So, but a couple of things, Lincoln County is predominantly ag based. So with agriculture being one of those things that continues to go, our ag community is continuing to run out there. The farmers are in the fields, and the seed companies are rolling, and the fertilizer companies, we've got some of that going. A couple of things that, our hospitals, we have 2 small rural hospitals here that have geared up and have taken on the challenge of keeping us safe. They've done a marvelous job, but they are financially really starting to take a beating in this. Even with some of the help they've gotten, it's going to be very tough for them to continue to operate, under these circumstances. I know we've got some elective surgeries we can get going now and stuff like that, but that's really a tough thing for a small, and I'm sure you have a couple other counties talk about that. One of the things that's been is our county fair. We have our county fair coming up in August, and we've been having some discussions. I know there was a big Zoom meeting yesterday with a lot of the fairs throughout the state on what they were looking at doing. A lot of kids plan on that with their animals and your stock contractors and all the things to put on a county fair. So that's one of those, as you're looking out, clear out 3 months into the future, 4 months into the future, trying to make those decisions now are, I told somebody the other day that no matter what if we decide not to have, if we decide this Monday, if we're going to have a fair or not, it'll be one of the toughest decisions that I think in my 12 years as being a commissioner I'll ever make. So that's a piece. Our schools we have 9 rural schools in Lincoln County. They've all been, getting those lunches out to lunches and breakfasts out to the kids and the school buses and delivering them around and in town and stuff there. And to echo Commissioner French's on the budget, we don't have a lot of sales tax isn't a big driver for us, but I can tell you there are our interest income, I think, is going to be something that, when this all started, when the stock market took a hit and the Fed dropped dollars and stuff, that interest income's a big piece for most of our counties. And so that's going to be one of those pieces. And the other one is gas tax. Gas tax is going to be a big piece of, for our roads. Lincoln County has the 3rd most county roads of the state of Washington, and we really rely on that gas tax. And if we're looking at, who knows, 25, 30% or whatever decrease in gas tax for 60, 90, 120 days is going to be a big hit. So I just, like I said, echoing a lot of things Commissioner French said, this idea of a regional approach, maybe to opening some of the things that are happening. You know, we rely in Lincoln County so much on the things, and 60% of the workforce in Lincoln County works in Spokane County. So we really rely on the things that they do and the decisions they make. And so we're anxious to hear, you know, watch what's going on there, hopefully be a part of that as we open up things, that we do it hopefully on a regional, hopefully this whole 5 counties that are on the phone can look at that. So that's all I have, Melanie. I don't know if Commissioner Kaufman or Commissioner Stedman has anything.
I don't have anything, Scott. Thank you.
Commissioner Hutzel, I have a couple of questions, excuse me, for you, or if anyone else wants to take them. I'm curious specifically about being such a rural county, what your broadband issues have been trying to do remote education and telehealth and things like that, if you've had any struggles there. And then I'm also curious, because we've heard about it on other calls, about with agriculture, if you've had supply chain problems and whether any of the industry is essentially going to waste because of the inability to get it to market, for example.
You know, Melanie, we're, you know, pretty much in Lincoln County, you know, dry land wheat farming is the biggest part of it, some irrigated wheat. You know, we've got some hay grounds, not a lot of what I would call big cattle ranchers anymore, but you know, I see those calves out on the ground now and looking, you know, they'll be raising those for market for the fall. Few potatoes in Lincoln County. You know, I saw the potato drive that Representative Dye put together down there. We got email from Commissioner Marshall down there about coming down and getting some spuds, but that's going to be a tough deal. That you know, so the spuds, are they going to put them in? Are they not going to put them in? Yeah, we've got some pockets of potato growers here too. So that's right now, you know, the farmers that I deal with in my business, you know, every day and have for decades now, they're out there seeding that wheat into the ground and going like, you know, because that is you know, most optimistic group ever are farmers. So they're gonna keep trudging ahead and going with that. And what was the second one, Melanie, about?
Broadband.
Yeah, broadband. You know, you know, broadband's an issue as I, you know, chair the Public Works Board for the state and deal with that a lot around the state, pockets of places we do have broadband and we don't have broadband. I think what's really the piece, I talked to Senator Wellman the other day a little bit about K-12 and the kids that are out there, and that's what's really starting to show up is our needs, you know, where we have really fallen down on building that out in a lot of the you know, rural areas in all 39 counties has been a tough deal. And so some kids are getting it. I know we've been working on some more Wi-Fi hotspots around all over the state of Washington, trying to get to places where kids can get access to broadband. But that is, I think, it really shows, like Dr. Lutz said, some of the things that we were really lacking in something is not prepared, is hopefully that type of communication piece and what we need in broadband will really surface, and hopefully infrastructure, you know, that is a big infrastructure piece that we've learned from this, you know, what we can and can't do. So hopefully all you legislators out there that are listening on, that it's a big thing, and connecting with these kids is, boy, it's going to be tough. These kids they're going to be behind some in this thing headed in, and whether they had broadband or not. So I kind of feel for them. So, but broadband, it's an issue, Melanie. It's an issue in all 39 counties.
Thanks, Commissioner. And if not to monopolize the time with Lincoln County, but to keep you on the hot seat for a moment, I think Eric has a question as well. Eric, if you do, you're muted. Eric, I'm trying to unmute you, but apparently I can't. So, oh, wait.
Can you hear me now?
Oh, yep, there we go.
Okay, I'll move to my computer.
Oh.
And we've lost you again, Eric. Maybe you can type it to me and
Say that again.
I said we lost you. We didn't hear any of it
Do you have me now?
currently.
Okay, so the question I had for Commissioner Hutzel dealt really quite specifically with interest income. Is one of the things we compounded the problem during the recession was not only did we, the interest rates went down, we drew reserves down so much that not only did we, it was a kind of a twofold problem. We didn't have as much invested either to generate revenue. And I think that's going to be, again, a challenge for us, is that it's just not the rates that are going down, is we're going to draw reserves down deeply once again too.
Yeah, Eric, so just an example for all of you out there on the interest income on Lincoln County back in 2008, 2009 on interest income, in 2008, Lincoln County had $400,000 worth of interest income to the county into the general fund, into current expense. In 2009, we had $40,000. So that was the impact at that time over a 1-year period. And we're going to see this, inside of 2020 real quick. And like I said, it's going to hit real fast. So, you know, when you start looking at these budgets, what are we going to have to do? Like Commissioner French said, these budgets, even inside of 2020, what are we going to have to look at? So, because it hit much faster than the recession did.
Thanks, Commissioner. Why don't we now move on to Stevens County? I know we have at least one commissioner from Stevens County on the line. Commissioner McCart, are you still with us?
Yeah, so this is Wes McCart. So a few things that I'll highlight that we've really been hit with. I'm going to start out with ambulance services. We have struggled for multiple years with having enough staff to run our ambulance. We have a sheriff's ambulance up north that runs the northern third of the county, or a little bit more. And the reimbursement rates for both Medicaid and Medicare are so low. Even with the fix that the state had a few years ago, the Medicaid rates still are low enough. We can't hire people and keep them. So we lose staff. I've got 4 ambulances that are functional, and a lot of times we're lucky if we have enough staff to run one of them. So we have 3 different ambulance services in the county, and at any given time, we have been struggling here lately to respond to the calls, and we haven't had that many COVID-19 patients in our area. So it's not the COVID-19, it's just stretch those resources even further than normal. Broadband's a huge problem in our Tri-County area, and I'll include Lincoln County. The Colville School District, the superintendent had contacted me and said, you know, I'd really like to work with the fire stations and put a hotspot at each of the fire stations so that these kids could go to the fire stations, open up their laptop, get on, download their homework, upload their homework that they've done, and then go back home. Great idea. If you have the backhaul to put a hotspot in the fire station. Our problem is if you live in the main corridor, you have internet. If you don't live in the main corridor, there's no infrastructure there that allows us to get those hotspots put in. So it's a huge issue, and this COVID-19 thing has just exacerbated that. Feeding folks, our food banks have been a big item here in this county for years. And right now they're seeing double, triple of what they normally see. Thank God for Commissioner Marshall and the farmer down there that was giving away the potatoes. We sent one of our folks down there with a little trailer, and he picked up 2 pallets of those potatoes to bring back up, which is very much needed. So getting a needed food supply up here for folks for folks that can't afford it is definitely a challenge. The criminal justice system pretty much being closed down the way it is. Stevens County is one of the big payers for Martin Hall. And when you are not incarcerating juveniles, which is maybe a good thing, but you still have to pay for all the expenses. Fortunately, Martin Hall has good reserves, so I think we'll be fine at Martin Hall for the facility, but it still hurts us in the long run for having to pay that higher bill with no kids in there. And I am very, very concerned about the backlog this is going to have in the courts. We met with our indigent defense folks, our attorneys here about 2 weeks ago, and for an update, most of our attorneys come out of Spokane, and we have contracts with them, but they also work for Spokane doing indigent defense cases there. So they're very, very concerned about the scheduling between the 2 courts of trying to get all this work done at multiple counties and trying to supply those contracts. And then, of course, no good crisis happens when you're prepared, right? One of the problems we've had in Stevens County is our emergency manager was out on medical leave. He'd had a couple of surgeries scheduled, and of course this hit right after he had a surgery, so we've had to improvise. Thank God one of our 911, our main guy at 911 dispatch used to be an emergency manager, so we've managed to corral his services in, but that means he's been spending his time to man the EOC instead of trying to juggle all the pieces at 911. And the other is our information services, all of our IT guys. We were down 4 staff. And so at a time when all of a sudden everybody wants to work from home, we have 4 less staff, which is probably about, I want to say, between 1/3 and 1/2 of the staff we have that we had open positions for. And as you can imagine, in a rural area, it is very, very hard to recruit good, reliable IT staff and keep them to be able to pay enough. So a lot of folks that wanted to work from home, we've had some very upset elected officials up here because we've had to tell them, I know you want to work from home. I know you want your folks to work from home, but we don't have the IT people to support you to get that. And we were unable to buy enough computers to even supply everybody either anyway. The other thing you had to concern yourself with, and it's an ongoing concern, is when you've got people out of the treasurer's office or the auditor's office, people doing payroll or accounts payable from home, having enough infrastructure to make the security is good enough so we don't get hacked into and then lose all money that we do have for ourselves and everybody else, the school districts and all, has been a very, very large concern. That internet security piece is extremely expensive, and we just don't have the money. So again, we've had to tell people, sorry, you'll have to make other arrangements. We can't have people working from home in that field. So I know our building is closed. I'm extremely concerned about going forward, what we might need to do as far as opening our courthouse back up for protective measures based on what people feel they need versus what do we actually have to keep everybody safe. And I don't want to underestimate what that is, but I can tell you it's a huge concern for me. That's kind of the big things I see on the impacts we've had so far. I've got a bunch of stuff that I could share with you for anticipated problems moving forward, but one of the things is our budget is we don't know what our budget is right now. When the revenues for sales tax come in, they're 2-3 months late from the time that it's occurring. So we won't see impacts for quite some time. We know they're there. We know they're coming. We just don't know what they are. So I'll see if Steve has anything. Commissioner Parker's on.
Yeah, thank you, Wes. Yeah, this is Steve Parker. I'm the commissioner from the north end of the county. So Colville is obviously it's our seat of county government, and it's our largest town. I drive through it every day, so we have a lot of concerns that, and the commissioner's giving you a lot of just strictly in county services, but the question that rumbles through my head all of the time is what kind of a county are we going to have back at the end of this? Because we've done a lot of structural damage to the sensitive fabric that makes up a county, and those are our small towns, the small town businesses. We have some businesses that are on the medium to even large size that will do well, that have been able to still function. We had one, Hughes Craft, makes a wide variety of boats, some of them used in commercial fishing, that was able to petition and reopen. But we have so many of our Main Street businesses that are languishing. And I don't know how many of them are going to be able to survive this. I've been hearing reports from owners that their revenues have dropped 65%. They're not able to make their necessary payments, let alone pay for payrolls. And those are the big issues that concern me right now, because they directly tie to the health and wellness of individuals and communities and the county as a whole. The situation that we are facing in terms of the health risks, I'm pretty confident with. As commissioners, we've worked extensively with our local health jurisdiction that crosses 3 counties in our instance, Tri-County Health. We've worked and been in conversations with our local doctors and the hospitals, and they're expressing a high degree of confidence that we're able to come back online without putting our citizens at risk. What that looks like is uncertain right now, because we're not able to get that message comprehensively across to the governor, quite frankly. And we've been trying for some time. We've sown in so much fear and uncertainty. And as we all know, it's those are the things that really begin to wear and tear on the fabric of a social structure. And again, both individually and at a community level. And how the Commissioner McCart alluded to the situation in our courthouse with offices locked, appointments only, and a resistance to have people in. We've instituted a high cleaning protocol. We have 4 hours a day devoted to sterilization procedures in the common areas as a way to maintain the health of the people that are coming in and the health of the staff. And still we have people that are expressing concern. And I can't say strongly enough that the absence of active cases across our 3 counties speaks for itself. That's what's motivating our health professionals, our doctors, and our hospitals to petition for regional opening so that we can have a chance to restart business. And if we're not able to get there, it gives me a lot of concern about the response of people and what recourse we have moving forward.
Thanks, Commissioner. I appreciate that perspective for sure. Just to do a quick time check, it's 3 o'clock, so we only have about 30 minutes left, and we still have 2 counties where we haven't gotten through the initial portion. So I just want to make sure everyone knows where we are. So let's move on now to Ferry County, talk about impact on functions. Then we'll go to Pend Oreille, and then we'll turn it back around and talk about looking forward. So Ferry County, do we have someone on the line?
Yeah, this is Nathan. Can you hear me?
Yes, thank you, sir.
Okay, I'll just make it short and sweet. We're kind of the other end from Spokane. You know, they're the big side, we're the small side of Eastern Washington, but we're much more like them than we are King County. And we're struggling in the same areas that most of the small counties are. Our schools are struggling, our broadband. You know, we have 2,200 square miles in our county, and the broadband is one of the worst. And so we're working hard on that. I'm concerned about our hospital and their finances. They need to get the elective surgery going back. We need to get back to normal as quick as we can. Our drug court, we've had almost complete failure with testing, and a lot of them going back on the hard drugs. We had 4 years of success, and now this, and that really hurts our community. Local businesses, a majority of them, I've been going through them one by one to see who's open, who's not. We probably only have about 10% that's not open yet, just because we don't have anything here. You know, our industry's gone. We've gone through disaster after disaster, and the few that are left, we need to support them. We need to allow them to open. And some of them are a little fabric store that might have 10 people a day that might come through one at a time. We need to be able to allow them to open as our hardware store is, you know, and follow the procedures and be safe. But I want to give them a chance to survive. And some of them are right on the brink. And we don't have a reserve. We have the courthouse shut down by appointment only. We're laying people off at this point because we don't know what this year is going to be. And there's a safety net with unemployment right now. But about October, November, and then I have to start laying people off. That's going to be a problem, especially if the safety net isn't there like it is now. But we're going to see, you know, the road tax, gas tax, obviously is going to affect our public works. The other taxes that we bring in, you know, I'm already seeing some signs of that in the county. So we're trying to prepare ahead of time to deal with that. But really our big push right now, you know, we work closely with the hospital and Tri-County Health. And I think we're on a good path. I think we could do a slow opening and get some of these businesses that aren't open right now on board and, you know, try to get back to, you know, some semblance of normal. So anyway, I'll keep it short. You know, most people understand the struggles, you know, that we face. And I just appreciate all the help that we can get and all the work that you guys are doing. Thank you much.
We definitely have heard themes throughout these 8 webinars for sure. Now, last but not least with this question, do we have anyone on the line from Pend Oreille?
Hello.
Hello.
You can hear me. Okay, good. So I also was starting my video so you can see me. I'll keep it brief. I'll also count on the next time because we took action today and I want to be able to share that at the end. So anticipating impacts to gas taxes, we did do a staged furlough in the road department. We felt like we were between seasons. We'd saved a bunch of money this year in plowing by modifying how we were plowing, and we're anticipating using that in roads. But unfortunately, we aren't going to be able to do that. But looking at our budget, they figured that by saving the money, having them furlough now and take advantage of the unemployment benefits, then we'll be able to save projects. So doing more projects and hopefully avoiding any layoffs further on, depending on how everything comes out in revenue. So I'm just going to say things that are new that haven't been said. Of course, we're concerned about budget as well. We did close our offices. We are planning on opening them next week on Wednesday or Tuesday, and we're preparing now to make sure we have safety procedures in place. But we'll also be looking very responsibly for each office there if they need to modify or change or ask us to close their offices or manage, because some of the offices, like the auditor's office, will get a surge during boat season and so on. We also did set up some Wi-Fi. We're able to do that in different areas. It is a concern to get that Wi-Fi in the northern part of the county. So that's something that we just want to make sure. It just shows the lack of how it's disproportionately affecting these rural areas that way. So I did get from our prosecuting attorney, I sent out this message to our electeds. She said that they're concerned. She's concerned about the cuts at the state level. So this would be kind of for our legislators on the phone, how those cuts to the state level might possibly impact county government going forward. People have mentioned, again, you have mentioned food security concerns and the lack of broadband. Our treasurer is looking at how our junior taxing districts might be doing. And so that's a whole thing that we're just really monitoring really, really closely to make sure that they're going to be able to manage okay as well. A lot of times they don't, and they could be impacted. So just really giving a lot of support for that and seeing how they're going to be doing. The sales tax, the fuel tax, all the interest earnings, which we already mentioned. But she mentioned she's curious if all the online shopping will improve our sales tax. So we've actually decreased some services in March and April, so she's noticing that those revenues are also being impacted. So we'll see lots of budget impact. But that's really all I have until the next time.
Thank you, Commissioner. So now then, why don't we just reverse course and start with Pend Oreille and move our way back up to talk about moving forward. And we have about 20 minutes left, so everybody just please be mindful of the time so we don't go too long. Thank you.
Oh, that was so sweet of you, Melanie. So, okay, what we did today was, I'm just going to go back for a second because moving forward, a lot of this does have a lot to do with our community, and we can't avoid that. We've only had 2 unrelated illnesses and no community spread, so they weren't spread to one another. And while we're mindful of that, I want to be cautious, we also are grateful for that. Our messaging has been very strong that, I'm just going to say it plain. Last weekend, I wanted some shorts. It's getting warm. And my boutique has been closed. It's closed. I would go there, but I can't. So I had to go to Costco and deal with the crowds. And it makes no sense. So instead of me going and importing some disease to my county by going there, I would rather go to the boutiques. So we coined a term called shop local, play local, stay safe. And that's been part of our plan moving forward. We've collaborated very well here. I'm very proud of our community between the hospital, our EOC, and all the emergency management services, including the sheriff's office, with our health district, to really get together a nice plan, which we just completed today. I did send that to WASAC, to NACO, to just about everybody else. Our clerk did, actually. So Melanie, you're welcome to send that out to this group so they would have a copy of our resolution and our plan. And it's basically asking to be considered for reopening through regional areas. So we took both the governor's plan on his policy, which is, if you haven't seen it, it's a policy brief April 2020, safe return to public life in Washington State. We used that, as well as the phasing that the federal government has provided. I really appreciate that every time on NACO and IGA calls, we hear federally supported, state managed, locally executed, and certainly we're the ones who are, you know, really our health district and all the questions we've had to deal with here and the tough decisions. It happens locally, so we respect the strategy and so on that's been going on at the state level, but we're executing it, and so that's what we want to do is get that plan forward, and hopefully it's being discussed. I understand that it is being discussed today with Secretary Weissman and Governor Inslee. They are considering this idea of regional, this kind of a regional plan. So we're ready, we're out the door, and I'm very excited to see that we were able to put that out the door. And that's really, I think, all I have. It scares me if it doesn't, what, last question, what scares you right now? Oh, if we can't do that, I'll tell you, our businesses are absolutely completely freaked out, and that's going to affect all of us in huge, huge ways. We've had a lot of frustration and anger, and you'll see that in our resolution. We tried to depict what people were saying. So please read at least the resolution.
Thank you. I did get a copy of both the resolution and the guidelines, which I haven't had a chance to look at in thorough detail, but I've glanced at and it looks pretty comprehensive. So,
thank you.
Yeah, let's move back up to Ferry County.
So Jonna, did you want to work on this one?
Okay, good afternoon. Thank you for putting this together. We're kind of in the same mode, I think, as most of the counties. We put together a letter on Tuesday for the governor, and we've been working with the Tri-County Health, the Board of Health, the hospital, in regards to a regional approach. You know, fortunately, we've had small numbers in our area, and we really feel like we could begin a soft move. As Commissioner Davis mentioned earlier, about 10% of our businesses need to get opened up, and we really need to support them now that we've got the construction going again, and we need to get people back to work. Our courthouse is talking about how we're going to move into the moving that together and making sure everybody's safe. I think one of the things that hasn't been mentioned in regards to broadband is that our libraries are closed, and a lot of our people depend on going to the library in order to do their email access, their internet access. So that in and of itself is something we need to look at. It'd be great to, Commissioner McCart mentioned the fire stations. That would be a great thing too, but I know in Northern Ferry County and Curlew, nobody's got access because the library is closed down, and the kids depend on that after school and to do a lot of their projects. So that has set things, I think, back even further. Commissioner Hutzel mentioned the fairs, and I was on a call the other night with the fair board setting up our fair in September. That's huge for the county. So we really need to take a look at that and get our hospitals back to elective surgeries. That's been an ask in every letter that we have sent out, and just the fact of trying to do a regional approach. So I think what scares us right now is we'll have to see what happens on May 4th and how people are going to feel like we need to move forward, because right now everybody's being reasonable, and I'm hoping that we can continue to be reasonable, but we have to open things back up again.
Thank you.
So since you're going backwards, I think
I
I'm next.
am. You know, it's you next.
So one of the things I want to focus on a couple of things that we really need, and that I'm concerned with. So county assistance dollars is huge to Stevens County. We actually receive over $1 million this last couple of years in county assistance, which is based on REIT largely, and I'm very concerned about where that might go in conjunction with the sales tax loss. If we lose both of those revenues together, we're looking at, as well as the gas tax, you know, I think we can survive this if we get a rebound short term, but if this drags on, or those tend to be large losses into next year, we're going to be in very deep trouble again, probably worse than we were in 2007. The other thing is that the the money that the state got from the CARES Act. You know, I haven't really seen how that's going to get rolled out yet, but I'm hearing that it's going to be reimbursement money. So in other words, we have to spend the money up front and then turn around and ask the state to reimburse us. Where I think, you know, the state may say that's a great idea from a county perspective. We are not the state's bank. If the state got that money already, why are we being forced to basically pay the bankroll for several months while we fill out all the paperwork and have all this go through the process of being checked, only to receive money that we've already spent? I mean, if they want to do that with part of the money, I guess I'm fine with that. But some of this money we're going to need now, especially the small counties with the influx. I'm also really, really concerned in our community about not having reopened the churches. I mean, if I can do social distancing in North 40 or Walmart or Costco, why can't I do that in my churches? This community is hugely dependent upon their churches. And that is an area where I'm just super concerned that the governor keeps us closed in that manner, and it's not helping. The other thing I have really big concern on is we have made some great big huge strides in telehealth as it relates to behavioral health, mental health, and chemical dependency, where that is not always effective. We were able to do that because of some relaxation in the HIPAA laws. And we have some really big issues with licensing of our facilities for emergencies and being able to do telehealth if the need arrives in behavioral health due to HIPAA concerns. And I think that's something that the state and the national could help us on. With that, I'll stop.
And I'll just give a quick, so we can get to the other counties. Thank you, Commissioner, for mentioning the churches. And to be blunt, I've been contacted by some of the church leaders across the area, and they plan on resuming services, determining that it's their moral duty to, as they put it, obey God rather than man, and they don't feel that they can continue to ask their people to stay away. That's some and not all. A couple of things that I would just add is we're also working with our local health jurisdiction. They're starting now, or they will be starting this weekend, to pencil in what regional reopening would look like from their standpoint. And we've also been working with our EOC to develop and put together what they're coining business reentry boxes, which would give them a supply, an initial supply of the sanitary devices that may be required for them to be comfortable and to make their people comfortable, which would be sanitizers, masks, and those things, along with a general guideline to show them and remind them of what the protocols are going to be. And I think those will be really helpful for businesses to help them move forward. Just wanted to add that.
Thank you. And how about Lincoln County?
Yeah, I'll do a couple things, Melanie, and I'll see if Rob wants to chime in. And Commissioner McCart and Commissioner Parker, our churches, I'm glad they brought that up. That's we need that as a society right now, big time. And also on the behavioral health and mental health, we're not even seeing it right now. The issues, I mean, we're going to start seeing that as this continues to progress. So issues that are going to pop up in that world that are going to be very, very tough and stuff. One of the things I did want to bring up too is for our legislators that are on the phone is, you know, we are constantly talking about flexibility in our funds within the county. That this is a time that with the revenue shortfalls and stuff, that there, you know, we're always talking about some of the things with flexibility and REIT and some of those dollars that we have. And I think you're going to see this will be a time that we could really use some flexibility with some of the dollars that we have inside the silos in our counties. Just a temporary deal to be able to move some of those dollars around and let us at the local level really know, you know, what we need to do locally to have that flexibility. So that was just one more thing to toss in. And I don't know if Commissioner Kaufman had anything else.
Yeah, Rob Kaufman here. Just real quick, we need to do whatever we can do to help the governor see the light of day about opening up the new construction instead of just the stuff that's was already permitted prior to the proclamation. So one of our minuscule sources of revenue is from new construction, and so, you know, we got only about $10 million last year, what equates to about $20,000 to our general fund. So every little bit's going to help us. The contractors don't see any difference between going out and building a house that was already permitted as opposed to starting a new house. So whatever we can do, whatever you guys can help us with, that we'd appreciate that.
Thank you. And last but not least, unless we have anyone else who wants to weigh in there, we will move to Spokane.
So I think the big I'd like to see out of the governor's office is clear direction. We need a date certain to reopen and realistic and achievable protocols to define what it is that we need to do to reopen. If we're not going to be able to reopen, then the state needs to be able to do one of two things. One, send a lot more money. Otherwise, they're going to see a lot of counties that are stressed beyond what I fear is repair, or somehow start to give us some relief from some of the mandated functions that you expect county governments to do. And I think it's some of the other commissioners indicated, you know, give us some flexibility with the funds that we are still receiving, REIT flexibility, some of the other taxes that are dedicated taxes. Give us some flexibility to be able to use those, even if it's only on a 2-year program, so that we can stand up our economies until we can get ourselves out of this. The other thing that I worry is that if we don't start giving our citizens some goals, something to strive for, then other than just another extension, I worry about civil unrest. I worry that people are going to reach a frustration level to where they just say, you know, the heck with it, we're going to do whatever we want to, and then that will lead to a flare-up, or they engage in other activities that then put stress on our criminal justice system and stuff. So we really do need the office to understand that we are achieving goals. We are doing the things that the wants the regions to do, and we should be rewarded by allowing us to get back into business, get people a paycheck, not an unemployment, because at some point the state or the feds are going to run out of ink, and we're not going to get those checks anymore, and then we're going to be in a tough spot. I'm now off my soapbox.
Thanks, Commissioner Wayash. We get on it, didn't we? Do we have anything else anyone wants to share? We do have about 5 minutes left, so we can do some last words or some questions. We don't have any questions in the chat box, just a couple of comments from Eric that to make sure that you all saw. One saying what Martin Hall was to make sure people knew, and then also saying that many counties have talked about the shortage of IT staff. So when that came up earlier, it's definitely a theme that we've heard from. Does anybody on the line have any questions? Feel free to type it in or just to unmute yourself and ask. Okay, well, I wanted to give it time just in case people were talking without realizing they were on mute, but I want to say thank you to all of you. Know you're working very hard and definitely have a lot of frustrations and concerns, and certainly you are not alone in the types of things that we have heard in all 8 of these webinars. So I said earlier, I think that these are being recorded, we're taking notes, and we will send out the recording and the notes from this webinar, but we will also be putting a compilation together of all of them. So we'll get to see what the themes have been throughout the course of all of these calls. And we will share that just as soon as we have it done. Appreciate that you haven't been hit as hard, all of you over there, and I imagine that actually creates kind of a different set of frustrations maybe than some of the other counties have felt in terms of having to respond. So I think it's good that we got the opportunity to see that perspective too. So again, thank you all so much for your time, and for our legislators and our legislative staff. We appreciate that you've hung in there with us on this. And just to tell you a little bit about what WASAC has been doing, we have been communicating regularly. We have weekly phone calls with our IT directors, our county administrators, the commissioners and council members, our engineers, our planners, our local solid waste affiliates, and so on. So if you have any questions about what people are up to in any of those departments, please don't hesitate to reach out. And also, of course, if you just have any questions in general, we've tried our best to stay as engaged as possible with the governor's office and as up to date as possible on all of the proclamations and the changing rules regarding construction and things like that. We have a couple of WASAC staff who are sitting on that work group, for example. So please don't hesitate to reach out, check in with us if you have any questions or concerns. And with that, unless anyone has any last words or thoughts, we can hang up a couple minutes early. Oh, Commissioner French is waving his hand.
Yeah, I think one of the other messages, if you have the opportunity to communicate with the governor, is that, you know, in the case of Spokane County, I'm right next to Kootenai County. And when he shut down construction here in Spokane County, you know what happened? All my workers went to Idaho. And so even if he were to turn on the economy, my challenge is how do we bring my workforce back and stuff. And so this is not only in construction, but a lot of other related industries. It's not going to happen overnight. It's going to take time to bring people back into this market and get our economy standing up. So the sooner the better.
It's a great point, Commissioner. Okay, do we have anything else, or should we go ahead and say goodbye? Okay, well, thank you, everyone. Have a great day, and we will talk with you soon. Thanks for your time.
Thanks, Melanie. Thanks, everyone.